How you doing? You okay? Hi, my name's Tom. I'm one of the coordinators for the Primary Care Support Services team here at FCMS. So home monitoring really falls into two categories. We've got remote home monitoring and virtual wards. The difference between the two being such, remote home monitoring is there to help identify early signs of deterioration in a patient's condition. This can help support the patient at a much earlier stage if necessary, but it can also avoid and reduce unnecessary visits to A&E and potential hospital admissions. Whereas on the other hand, virtual wards are in place to allow patients to get the care they need at home conveniently and comfortably, rather than being in hospital. Our home monitoring services began with us monitoring patients with COVID-19, looking to detect signs of deterioration at a much earlier stage, and this was before any other means of protection against the virus were available. Since then, over the last couple of years, we've managed to support patients with up to 10 different kinds of health conditions, including things like heart failure, COPD, respiratory infections, and patients pre- and post-cardiac procedures. Working alongside software providers Docabo, patients are provided with the equipment they require dependent on their health condition. This equipment can include blood pressure machines, pulse oximeters, weighing scales and pedometers. We also provide the patients with a smartphone or tablet if they don't have their own, so that they can send us the data that we require. Our clinical and admin teams will go together to a patient's home to supply the equipment, demonstrate how it all works thoroughly before leaving, and make sure that the patient is confident and happy with doing what's been asked of them. Here at Newfield House, our home monitoring hub, we have a multi-skilled team of colleagues with years of experience and a wide range of knowledge. Our clinical team consists of advanced clinical practitioners, practice nurses, pharmacists and HCAs, just to name a few. When we receive the data from the patient, our clinical team are on hand to monitor this and make sure the readings are within their specific parameters. If not, then the clinical team will follow the appropriate course of action. If data is not received, then our administrative team are on hand to contact the patient to check that everything is okay.
So when a patient is onboarded onto one of our services, they're given a welcome pack, which includes instructions on how to use the equipment, how to log into Docabo, and how to record their readings along with telephone helpline numbers. If they have a problem, they can contact us on our helpline numbers between 8 a.m. and 6 p.m, 7 days a week, 365 days a year. We also give the patients an out-of-hours number should an issue arise outside of our manned phone times. Alternatively, the patients can also send a text message through Docabo, which goes straight to our clinical team.
Patients that we've spoken to have given great feedback and saying that they love being at home in their own homes with the friends, family and pets around them. The service aims to keep our patients safe and well whilst being monitored by our team of clinicians, and any change in conditions can be escalated to the appropriate level, thereby potentially saving lives.
We meet daily with our respiratory consultant from the local trust, the respiratory specialist nurses and the rapid response nurses. Rapid response provide their updates of the face-to-face visits to the patients, and our service can update on patients who are monitoring their own readings. So this enables us as a team to keep a close eye on these poorly patients in the community and raise any concerns before the patient becomes more unwell. As we can discuss the patient's condition directly with the consultant and the secondary care team, there's no delay in changing treatment or care, and we can avoid a hospital admission. The consultant has access to the GP records via community EMIS, as do the other clinicians on the MDT, so we can keep the GP up to date with their patient's care in real time. We have the option of asking Rapid Response to visit any patients that are giving cause for concern on the remote monitoring pathway by discussing them at the MDT. If the patient deteriorates and needs a hospital admission while on the virtual ward, we can ring the medical on call at the hospital and arrange admission, bypassing the usual pathway. We can access patients who would ordinarily struggle to access health care, for example, housebound patients with long-term conditions. These patients have a single point of contact, a helpline number, and access to clinicians in a way they've never had before. And we can monitor their data and liaise with their GPs, raising any medication changes or concerns that we may have from the patient inputting their data to our system.
The main aim for this service is to make sure that patients get the care that they really need within the comfort of their own home, and knowing that if they do need support, they've got us on the end of the phone to help them out when needed.